I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our Friday Facebook update on the impact of the COVID-19 pandemic on Mobile County. Worldwide, again, we have more than 12 million cases and over 500,000 deaths. In the U.S., over 1.3 million cases and around 133,000 deaths. In Alabama this morning, we're crawling up on 50,000 cases, not quite there yet, and over 1,000 deaths, 1,077 this morning. So I'm afraid the news is bad for Mobile, Alabama as well, for Mobile County. The first thing I do in the morning when I get to work or if I'm at home is to look at the numbers that were reported for Mobile County residents the previous day. And today, it nearly took my breath away. So yesterday, 203 laboratory confirmed or probable cases of COVID-19 were reported for Mobile County residents. That's a 100% increase, so a doubling of the number just the day prior. And it's just staggering to see the number of cases that are being reported. Lots of people have asked me today what I think has caused that. Was it did a laboratory or two, send a lot of results that had maybe been backlogged? I don't know the answer to that question yet. I fear that it is a real increase, but we know that from time to time there are some other explanations, and so I'll be taking a close look at that this weekend to see if there's anything other than just the large and widespread and rapid community transmission behind that number. But again, yesterday added 203 cases. I want to comment briefly on the enormous volume of laboratory reports that are received statewide and the burden that is placing on our case investigators and our contact tracers. And we are all working 7 days a week, many long days to try and keep up with COVID investigations, but we're beginning to lose that battle, and we're seeing sort of the number of the lab reports that have not been investigated just gets larger and larger as we see, hundreds of cases reported every day. So because of that, the numbers reported in our daily report for the number hospitalized and the number died are absolutely underestimates of those things. When we're not able to reach patients to find out about their symptoms, to find out about their hospitalizations, or if they have died, we have to rely on hospitals and medical examiners and nursing homes to contact us to tell us about that information, and that is incomplete at best. So we may change the way that we're reporting on hospitalizations and deaths next week to try to provide you with the most accurate picture of what's going on in our county as we can. The daily reports, those are based on lab reports, and those are processed electronically. The positive lab results do not need a human to touch them to get counted in our daily report. So we feel good that number is valuable and expresses or represents the number of cases that we actually have reporting. We don't have a lot of distrust in that number, but in the hospitalizations and died, we do. We know from the Alabama Incident Management System, the AIMS system, that public health and emergency managers use and hospitals use daily, that the number of people in the hospital with a COVID positive test doubled in just the matter of around 7 days. So last week this time we were averaging 65, 75 people in the hospital each day with COVID-19, and this week it has moved into the 150s, 170s, and we're seeing that creep up. So our hospitals are definitely stretched thin, as the health department is. So again, we just implore that if you can avoid elective procedures, or if you can avoid an emergency department visit, maybe by going by urgent care, please try to help us help the hospitals keep as many beds open and available for our most critically ill community members as you can. Would be greatly appreciated. So let's see a couple of questions and comments. Several people asking about the large number of cases, and again, my gut is that is a real increase, that number of 200, and it is shocking. It is very shocking and worrisome. But if I find out something differently, I'll tell you about that on Monday. Someone was asking about, do I think herd immunity is an option given all the positive results? So, we're still learning about the immunity that someone develops after a COVID infection, and we just still don't know enough about how strongly the immune response can protect you, or how long it will protect you. So yes, a lot of people getting infected generally builds herd immunity, but because this is a novel coronavirus and we're still studying and learning, I don't think we can yet say that we are at the point of trusting that herd immunity is being built and can be relied on to protect us down the line. We're still very hopeful that there will be a human vaccine by the end of this year or early next year, and there are promising treatments that are in clinical trials, and we are hopeful also that some of those treatments will prove useful for controlling the pandemic, because when the entire population of the globe is immune or is not immune, that is naive to a new virus, it puts us in a very fragile situation, and you can see that as we're just having record numbers of cases reported almost every day. All right, some other questions about do I think that the county or the state should take more drastic measures to contain the spike? Yes, I do, but I don't make those decisions. So what we have to rely on now is what we have to protect ourselves now. And that is our recommendation to, wear a face covering when you're out, use physical distancing, stay at least 6 feet away from anyone that's not in your immediate household, cover your cough, stay at home if you're sick, wash your hands frequently, disinfect surfaces. All of those public health messages that we've been advocating for are what we are relying on currently to try to slow the spread. It's not nearly as much as we probably need, but it's what we have right now. I think it unlikely anytime soon that you will see more drastic measures implemented to try to slow the spread, at least by our government leaders. Let's see. A question on here from Facebook that I won't be able to answer today because I worry I might get it wrong, but it has to do with self-serve beverage stations, and we'll address that on Monday after I consult with our inspection services team to make sure I get the answer to that one correct. Let's see, someone here, our business is expected to turn away customers who don't wear masks. Our business is being fined when they don't comply. So, businesses are not ordered, to force customers to wear a mask, but if you live in the city of Mobile, there is a mask ordinance that applies to you, and you must wear a face covering when you're in a business. But businesses that are in areas that aren't covered by a mask ordinance are not compelled or required to do so. We have been receiving emails, dozens of them every day, from people who have noticed that there is not compliance or not adherence to the Safer at Home order or the mask ordinance. And as we get those email referrals, then we call the business owner and really just, inform and educate them on the guidance in the Safer at Home order, and whether or not they are under a mask ordinance. And we try to help them understand the importance of face coverings and complying with the state safer at home order and the mask ordinance, and just try to walk them through sort of the negative side effects of not doing that they could potentially get themselves into a situation where they have widespread COVID among their employees and they have no one to come to work to open the store, that they have transmission among customers that maybe will blame them for not protecting them and stop shopping at their store, those kinds of things. But again, we are not authorized to write tickets or to shut people down. That's not the approach that we are taking. More working from a point of informing and educating and trying to help people understand why we make these recommendations, that it's for the protection of people and businesses. We want to keep commerce open, we want to keep retailing open, but you got to have workers and workers and customers to make that happen too. Let's see. Someone was asking why we don't provide the names of everyone who has COVID-19. And remember, a person's health information is protected by federal law, and that is their protected health information. And we are not authorized to release that information. So, okay. A little bit more. So on our complaint line, so we can take your referrals or suggestions at two different email addresses. The one that we're putting out there the most is iscomplaints@mchd.org. I believe there was a new infographic on our Facebook page earlier today or maybe yesterday on that. And we hear you. It's sometimes hard for us to find the sweet spot to try to make everybody happy when we aren't accepting complaints, and when we aren't calling people to try to get their compliance, then people fuss at us for not doing enough. And then now it seems like when we're doing it and we're trying to broadcast that we're receiving complaints, some people take that as not our business. So we are trying to keep the public safe in the best way that we know how, and that is to receive your comments, your referrals, your information, you're the eyes and ears out in the community, and to send the name of the business, the location of the business, and the approximate time or day that you were there to iscomplaints@mchd.org. And as I mentioned, this email address has been around for a very long time, and it's what we have taken complaints on for restaurants and bars primarily, but now we're repurposing it for any of your complaints. And then we have a couple different groups that are working on it, and depending on if it's a permitted establishment or a healthcare facility or something else, then we triage it to our teams that are making these calls. And again, just want to make sure that you understand that we're not threatening to close people down. We're not threatening to issue violations. We're just speaking with managers and owners and supervisors and shift managers to say, hey, we received a complaint. Your customers are concerned about what they're seeing in your store. We want to help you keep your business open and safe for your customers and employees. So just one more thing before we go, and just to remind you going into the weekend that we are still at a very high risk of COVID transmission in Mobile County. Our neighbors are at very high risk. Baldwin County, I believe, is still in a very high risk of COVID transmission, though their caseload is much lower than ours. Their rate of acceleration is very similar to ours. So I just want to remind you some of the things that you need to think about. Again, sort of our core public health missions, our public health measures. Maintain 6 foot of distancing in public spaces. Work at home if you can. If not, when you're at work, maintain 6 feet from other people. Wear a face covering as much as possible. Avoid all unnecessary travel. And if you must travel, avoid crowded areas. Avoid unnecessary visits to hospitals, nursing homes, or other healthcare facilities. This is really important that these things are heard and complied with so that we can try to slow this rapid acceleration that we're seeing. Wear face coverings, avoid groups of 20 or more. Takeout, pickup, or delivery from restaurants is strongly recommended rather than dining in. Even when you're visiting friends and family, wear face coverings when you're within 6 feet of people who are outside your household. So again, if you're around anyone who's outside your household, maintain 6 feet and wear a face covering to try to protect yourself. And please, while we are in this very high risk, consider holding online worship services. When you meet in person for religious ceremonies, keep that 6 foot distance between people of different households. Consider holding more services to lower attendance and more spacing between people at every service. So again, we, the health department, cannot protect the community ourselves. We need your help and we need your contribution to implementing and adhering to and helping us remind people what these measures are and why they're important so that we can try to slow the spread of COVID-19 in our community. So thanks again. Stay safe out there. Have a safe weekend, and we'll talk again on Monday.